Good evening, everyone. Michelle Quesada here, senior reporter at WPTV, and we are starting this Facebook Live discussion this evening to talk about the COVID vaccine second shot effects. For those of you who have received either the Moderna or Pfizer vaccines and you've had your second dose, you probably have different stories about how it went for you. We have a great story that we're airing tonight at 11 p.m. on our newscast on WPTV. We followed 7 people in our area and tracked their symptoms for 24 hours. So I want to introduce you to one of the participants, Mike Willens. He's here with me today, and we're going to chat a little bit about, what it was like for you, Mike, when you got your second Pfizer vaccine. And we also have Dr. Olayemi Osiyemi. He is an infectious disease specialist with the T. Leroy Jefferson Medical Society. Welcome, doctor. I appreciate your time.
Thank you.
And before we get started on the conversation, I want to show you all a snippet of the story that we are airing tonight. This is a great piece where we just get to hear from those 7 participants. So I'll let you take a listen.
My mom, her official 90th birthday is July 1st, and my 60th birthday is July 6th. So it was always an intent to celebrate this big milestone for both of us together.
I want to do normal things, guys.
Hi, Teresa Lane here on Monday, April 12th at 10:45 in the morning. I just got my second COVID shot 15 minutes ago.
Hey, it's Mike Willens. It's April 13th, 11 a.m. I just got my second Pfizer shot. I'm ready to live. It's like Christmas morning here. I feel great, no side effects.
Hi, I'm Robin Kolodny, and it is April 13th, a little after 5 p.m. I've just had my second dose of Pfizer. So far, I feel pretty good.
It's Ashton Irons. I got my second Moderna shot today. Feeling fine.
Hi, I'm Jamie Warren, and I got my second dose of Moderna on Tuesday, April 13th, and I'm feeling fine so far.
Yo me he sentido bien, no he sentido ningún síntoma. Hasta ahora, gracias a Dios, todo ha sido bien.
Hi, it's David Urban, and it is April 14th at about 3:35 in the afternoon, and I just had my second Moderna vaccine, and so far I feel just fine, but a great sense of mental relief.
It's been 10 hours since I had my Pfizer #2 vaccine this morning. I feel pretty good. I'm a little bit achy, have a little bit of a headache, a minor headache that comes and goes.
Hi, I'm Teresa Lane. It's been about 10 hours since my second COVID vaccine, and the only side effect I have is a sore arm.
So it's been over 12 hours. It's been 15 and a half hours, and I feel fine.
I got it around 11:30. It's now about 7:30. No complications. My arm's a little sore, but that's expected from the shot. And I'm feeling pretty good so far. Hopefully it continues to feel that way.
12 hours after my second shot, I'm still feeling good other than a sore arm.
El señor Valentín Fontanes, los síntomas son leves, menos que la primera vez que me puse la vacuna Moderna, así que muy leve los síntomas y por lo demás me siento bien, gracias a Dios.
And I can tell you that I had a bit of a discomfort during the night, the mild flu-like symptoms, and then developing into some body-wide aching. This morning it seems to be tempering off a little bit, but I still am a little bit fatigued. Other than that, I think I'm getting better.
I'm still feeling great. No side effects at all.
Every time I would move, my bones would ache and my joints would ache, and I still had a headache. This is nothing. I mean, I would trade this for getting COVID 1,000 out of 1,000 times.
My arm is sore like it was last time, and I have a little bit of body aches, but other than that, pretty fine.
Still achy and tired, fatigued, but I suspect it's going to get better as the day progresses.
It's just a very good feeling to know that I'm well on my way to full immunity.
A couple of weeks now after the kids all get their shots, their second shots, which they're scheduled for also, we can actually, I'm still going to wear my mask. I'm still going to do all the right things, but our confidence level is just going to be so much higher. We've actually started talking about maybe we can take a trip somewhere down the road.
I feel somewhat relieved. Of course, I'm going to wear a mask. I'm going to be cautious, as has been advised, but I'm not going to just stay locked in.
My mom, her official 90th birthday is July 1st, and my 60th birthday is July 6th. So it was always an intent to celebrate this big milestone for both of us together.
More anxiety waiting until the build up, and then now it's done, it's done.
Pues me siento tranquilo de saber que soy parte de un montón de gente que entiende que con esta preocupación que hay de la vacuna, pues tenemos que ser un poco responsables y prudentes.
I feel like for us it's a little bit of a relief to feel a little normal again.
Like Christmas morning here.
I feel just fine, with a great sense of mental relief.
And so there you have it. You heard from 7 of our participants, and you'll hear from them again tonight. And I just want to make sure everybody who's watching and joining in on the conversation, please ask your questions. I already see some comments about people who had pretty severe reactions to the vaccine, others who felt just fine. And Jamie Lauren, she's joining us now too. Jamie, you saw her just a few minutes ago as well in that story that we aired. She, of course, also did the Moderna vaccine. So we're going to get to hear from all of you. Dr. Osiyemi, I want to start with you. Talk a little bit about some of the reasons why somebody will have a reaction after the second vaccine and why others not after the second Pfizer and Moderna vaccines we're talking about.
Good evening. Just want to make a quick correction. I'm with Triple O Medical Services, not Tillera Jefferson. Now, why do people react to the vaccine? Everyone is different. As you can tell from the story you just shown, this is not unique to COVID-19 vaccine. With other vaccines, we've seen people who have mild symptoms while others have severe symptoms. With COVID-19 vaccine, the second shot tends to elicit more reaction. It's almost like your immune system is primed the first time around. So when you get that second exposure, you tend to react more violent or more, your reactions can be more pronounced. And we also noticed that people who had COVID infection prior to the vaccine then also to have more reaction. Again, it's almost like your body's seeing the virus and it's being stimulated and your response to be more pronounced. So that's very common.
And, I know that, Mike, you at the beginning didn't experience any symptoms. You had the second dose of the Pfizer series. And for the first, I think it was like 9 hours, you didn't feel anything until the 10th hour mark is, I think, when it took a turn for you. Talk a little bit about that.
Yeah, Michelle, when I got the shot, essentially it was just very sore over a few hours in the location where the shot was. But I felt great until I had my shot around 10 or 10:30 in the morning, and maybe around 9:30 or 10 o'clock that night, like you said, maybe around 10 hours, all of a sudden I just was kind of dragging, just ran out of energy, started getting a headache. It wasn't significant, but it was, I noticed it. I just felt like I was carrying around a bunch of bags of sand. I couldn't move too quick. And I had a little bit of a rough night after that, but no fever or any of the things that other people sometimes experience.
Yeah. And Jamie has an interesting story, because I remember when I spoke with you after you got your vaccine, you didn't have any symptoms, but your husband did. And there was one difference between you. Talk a little bit about your little secret of what you did.
Yeah. So my husband and I both got the same vaccine, same day, same absolutely everything down to what we ate, other than drinks, what we drank, is everything the same. I had very slight reactions. I had a little bit of a headache. I was a little tired and a sore arm. Other than that, I was totally fine. But I heard from a friend of mine that she was a nurse at Memorial, and she said that a lot of her friends when they were getting their vaccines, were taking emergency 3 days before they got their second dose. And it was the only difference that my husband and I had very different of every day of what we did in the days leading up to it. So I took a dose of emergency every day for 3 days before. Figured it's emergency, it can't hurt. And yeah, I really didn't feel that bad.
What do you think about that, Dr. Osiyemi? Do you think that she gave her immune system a boost, and maybe that could be a reason, or is that a myth?
I don't think I doubt that's the reason, because, like she said, When I had my vaccine, my wife also had the same vaccine at the same time. She was out for the night, and I was, I had the mild symptoms, and we both had the same vaccine. And of the 20 people that had the vaccine the same day, 50% had nothing at all, while other 50% had various degree of symptoms. So it's really difficult to say. I mean, people try to hydrate before and after, just trying to reduce the symptoms, but it's hard to really prevent absolutely any of the symptoms if you're gonna get it.
Yeah, and I see a comment here from Amy Carey. She's saying that she had Moderna, the vaccine series, and was sick for 4 days. Is that unusual, Dr. Osiyemi? I mean, normally with these vaccines, will you see a certain window of time where you're going to have symptoms and then it's gone?
If you're going to have symptoms, it tends to be within 24 hours, and it tends to last 24 hours for most people. However, some people will have prolonged symptoms for a few days, but that's pretty much the exception to the rule. The majority will resolve within 24 hours.
And my husband was one of those.
So it was gone within 24 hours?
Nope. He had over 36 hours. He had body aches for a few days. He had 103 fever at one point. Yeah, no, my husband was absolutely one of those people who just had a reaction. And at the end of the day, yes, my husband's gone through chemo, radiation, the whole gamut of things in the last 2 years. So while that probably can contribute to it, who knows? But yeah, other than that, the only difference is
that
if you had cancer before, that we've noticed that in cancer.
And it was a brain.
Yes, that we've seen that in those patients.
So if you have underlying conditions of cancer in the past, you could see more severe effects.
Yeah, cancer patients tend to have that more reaction, yes.
That's all right. And, David Kettner, he commented that he did the Moderna and had no side effects whatsoever. Doctor, should anybody be concerned if they didn't get any side effects? I mean, does that mean the vaccine was more for someone who did or didn't? What's the medical response to that?
No, I mean, there's no data suggesting there's a difference in your response rate to the antibody development. So I wouldn't really worry about that. I wouldn't use that as a factor to determine whether you had a better response or not. Obviously, you would like to think so, but I don't think there's enough data to suggest that's the case.
Yeah, and Mike, your entire family did Pfizer, right? And did you all have different reactions, even within your own family in different ages?
It was mainly the same. My wife's reaction was identical to mine. She didn't really have anything of any consequence. My stepson, who's 19, he was pretty achy and dragging for about 3 days, but he never had a fever. He stayed home from work, was about the most significant of it. My other two sons had no issues whatsoever. They were good to go. My stepdaughter, who's just turned 16, had her her first shot yesterday. I know we're talking about the second shot, but she had her first shot yesterday, and she's fine. I mean, she hasn't said a word. So we've been very lucky. No real issues. I'm curious I haven't heard a single story of anybody having any of the second shots and being hospitalized as a result of their fever or anything. Is that, I know that's very uncommon, but is that just, I'm asking the doctor more than anyone, is that a complete outlier? I mean, that just doesn't happen?
It doesn't happen very, very often. I've seen maybe a couple of cases over the last 3 months where people had the vaccine end up in the hospital with fever and not feeling well, but that's very uncommon.
Yeah.
And I just want to remind everyone, what we're talking about here. We're talking about the effects of the second dose of either the Pfizer or Moderna vaccines. And, we have a story airing tonight at 11 o'clock on Channel 5 from several people we tracked for 24 hours after that second dose. Obviously, you'll hear from them. We want you to ask questions. If you have questions for the participants, if you have questions for the doctor, please, by all means, ask your questions. And Dr. Osiyemi, another thing that comes up too is, we saw just a few minutes ago in the video, Pastor Fontanes actually had a strong reaction to the first shot of Moderna, but not the second one. So is that also something that you've seen as well, or is it less common?
That's less common. Most people tend to have reaction to the second dose rather than the first dose, unless, of course, you've had COVID infection prior to the vaccine, then your first dose, you may have a reaction to it. And some people may have reaction to both doses.
It just depends on the person.
Correct.
Okay. And, I know it takes 2 weeks to have, build up the immunity that the vaccine provides for COVID-19. Mike, anything that you have, you're now past your 2 weeks, because I know you did it way before my second shot, which we also have a story up on our WPTV's page on how it went for me, which was not well. For you all, what plans, are you looking forward to already doing after these 2 shots, or anything that you have done differently since you reached that 2-week period?
Well, the biggest thing is we're abiding by the CDC guidelines. We still wear our masks when we go into restaurants and grocery stores and all of that. I would say we all feel much more confident when we're outside. I'm not covering my face when I walk from the car to the front of the grocery store, because I just feel so much more confident. Plus, it's not really required anymore. But as far as plans, I mean, we went months and months and months with only eating takeout food at our local restaurants. And this is graduation season. I've got 2 graduates happening. We have a bunch of family meals planned over the next 2 or 3 weeks. And it's not so much that we're going out to dinner, it's that we've transitioned very quickly back into that, let's just go wherever we want to go. A year ago or 9 months ago was taking all this research. Let's call them. Let's find out what they're actually doing. Are they seating 50% capacity? What are the precautions that they're taking? And now we're shifting. I don't think it's prematurely, because we do still, we're still careful, but we're not afraid. We're getting to live again.
Yeah. And are you saying, doctor, too, like people who are getting complete the series of the vaccine, once they go through, whether they're going to have symptoms or not have symptoms, that they feel like they have this like super, shield of protection? I guess you can describe it that way.
I think so. I mean, I feel so much more empowered to kind of get back at it. And I see that all around. It's just, we're not just walking around with this fear all the time. That's a big deal. That may not be true for everybody.
I'm sorry about that. I have a puppy German Shepherd, and every time I do Zooms or Facebook Live, he always tries to come.
Mine's downstairs, so she can't do that.
I feel so bad when we hear these stories about people who've had a rough time of it, because it seems like this highest percentage is, they have maybe a achy day or so. Jamie said she had it great, but her husband was really suffering for 48 hours. So I almost feel bad that we didn't have any of that going on. But once everybody's through that, like Michelle, you had a rough time of it, but now you're probably out there ready to go to concerts and go to the movies and do all the things that we used to do and not even think about it.
Yeah, definitely it gives you a sense of confidence. That's the whole point of getting vaccinated, right? We have all these discussions about, moving forward, and this is part of that. For me, it was one of those cases where my effects lasted 32 hours after the second Pfizer vaccine. I had ongoing fever for well after the 24-hour mark. Dr. Osiyemi, a lot of people ask, is there an average time range of what the vaccine effect normally lasts, or what's normal, and what's not normal in that situation?
You mean the efficacy of the vaccine, the duration?
No, the reactions of the vaccine, like within a certain time period, what's normal to have vaccine reaction? If you have it longer than a few days, should you then be worried and speak to your doctor?
Great question. I think if your symptoms are lasting more than a week, I will seek out to your doctor and see what's going on. Most reactions should resolve within a week, and your response to the vaccine should be adequate 2 weeks after injection. So it's conceivable that you may have some symptoms up to 2 weeks post-vaccination, but you shouldn't have anything really realistically beyond that.
More than a week. And, this week we also got huge news from the FDA. I know that today the CDC gave the green light to start vaccinating 12 to 15-year-olds as well. Amanda has a question about that. And, she comments, just got our second today with Moderna. We have a son who recently finished chemo last year, 4 years old. We expect younger children to be added to the vaccine list. And what about children with history of cancer?
Yeah, cancer is not a it's not a contraindication to getting the vaccine. In fact, when you have cancer, then you are more at risk for severe illness if you get it. So get the disease. So the vaccine is extremely important in that population to try and prevent that severe illness.
And I was going to jump in on that. It's like my mother-in-law has a severe immunocompromise. And this is the reason she's taken 2 doses of Pfizer already. She's also taken the Johnson & Johnson. She has a no immunoresponse. And, for me, I come from a medical family. My husband's family is everybody's a doctor. Mom's a doctor, dad's a doctor, brother, aunts, uncles, grandparents. Everybody is a doctor. And, that's the reason that we need to, people need to take a vaccine. I've had my mother-in-law who's had a vaccine injury from taking it, but she'd rather do it than, not be able to do these things. And she's one of those type of people that the reasons vaccines actually exist is that people who are severely immunocompromised and can't take vaccines and don't actually have any response to these vaccines, it's just, she needs, these are the type of people we need to worry about, protecting the people that actually can't, regardless of their own personal decision on how you feel about it.
Yeah, and I know for your husband, that was a big decision since he has the prior cancer history.
No, it actually wasn't. Nope. He had no hesitation. He went to his oncologist. As soon as he cleared it, there was absolutely no hesitation on taking the vaccine, whatever he could get.
Yeah, and back to really quick to Amanda's question. She was talking specifically about her 4-year-old. Now we know that the vaccine hasn't been approved yet for anyone younger than 12 years old. So, doctor, do you foresee? I know the trials are still underway for at least Pfizer for 6 months old to 11 years old. Do you foresee that changing, soon or moving along quicker? By when could we possibly expect to see more news about that?
Yeah, I think the study is ongoing. When that will finish is hard to really tell. But I think by summertime we should have more data on that because that's the population we're looking at seriously. And just to mention, for people who cannot take the vaccine for any reason, in the near future, there will be an opportunity to take a drug like monoclonal antibody to prevent an infection. There's a study that was completed by Regeneron in a sub-Q injection of monoclonal antibody as a means of preventing an illness if you cannot take the vaccine. So there will be other options in the future for folks who, for some reason or the other.
And that's my mother-in-law's option. My father-in-law is a doctor, is a physician. He said, if God forbid she does, that's what the first thing he's going to do. Is going to have monoclonal antibody treatment for her. God forbid, in the event she does get exposed or does get it.
Yeah, Dr. Osiyemi, what kind of medical treatments right now would prohibit someone from being able to get the vaccine or have to wait a certain time to get it?
I mean, it's really not a whole lot of contraindication for it. Age will be one thing for those lower age group that we don't have enough data yet. And for patients who are maybe women 50 years or younger, who they may decide that they don't want to get a Johnson & Johnson vaccine, but they will have opportunity to get the Moderna and Pfizer. But that's up to them. That's optional for them. Doesn't mean they can't get the J&J vaccine, but they have the option of electing to take the other ones. There are people who've had severe reaction to all the vaccines they've taken in the past. You have to be cautious of those folks, even though there's no correlation between the older vaccines and these vaccines, because the Moderna and the Pfizer vaccine are what we call RNA viruses, RNA vaccine. So they are not developing eggs before people had the reaction to eggs, so they can't take certain vaccine. These vaccines are not that. So the only people that truly would be contraindicated in getting the vaccine are people who have reaction to the components of the vaccine. So you have to look at the package insert and see Moderna, Johnson & Johnson, what other stuff are in that vaccine. that I may be allergic to. If you're allergic to any of those components, then you shouldn't get it.
One thing that also comes up too, and you'll see, later tonight in our story, we had one participant who told me that she gets vaccines all the time and she gets shots all the time, and she had no reaction. I know there hasn't been enough time to study exactly what kind of the reactions are for these vaccines for someone who is used to, getting their flu shot every year, getting other vaccines throughout the year, versus someone who normally doesn't get vaccines. But from your patients, Dr. Osiyemi, have you seen that a lot of people who are routine vaccine, routine pro-vaccine, that they didn't get as bad reactions, or did that make a difference at all?
No, because the vaccines are all different. So there's no correlation between your response to other vaccines to this one. You may agree with the previous vaccines, and this one you may have reaction, or maybe vice versa. So yeah, I think if you have history of having a reaction to other vaccines, that's a possibility you could have reaction to this one, but there is no direct correlation between the two.
Yeah, and I think, all in all, we hear from a lot of people saying, well, you don't know how you're going to react to the vaccine, but you also don't know how you're going to react to COVID-19. Jamie, was that a big factor for you for deciding that you wanted to get the vaccine?
Absolutely, unequivocally. If half of what my husband had, I felt like if that's how awful he felt, with just his side effects from the vaccine, I cannot imagine how it would feel having actually COVID. I can't imagine how having to have a respirator on, versus wearing a mask. Even now that I am vaccinated, like, Mike was saying, I absolutely feel like I can do things more freely. I saw my entire family, other with the exception of my cousin who's in early stage of pregnancy, and my young niece and nephew, everyone is vaccinated. It was great to be able to do that. I actually booked flights for a trip to go see my goddaughter. So I feel like for me, it was absolutely unequivocally, there was no way I would rather feel awful from the vaccine. I would rather have had what my husband had, for 36 hours with 103 fever for a few days on end. Even with a lingering side effect, I still feel like that for me would be better than actually having COVID and being in a hospital, God forbid, or, I don't know how I would react to, having COVID. Could I have a mild? Could I have it very severe?
Right. You don't know. I mean, and there are people who have had COVID-19 and, were asymptomatic.
Right. Except there was.
Right. And so, I just want to wrap this up. I really appreciate the time that you all took to talk with us today. And I hope people get something out of this story. We're not trying to tell people to get the vaccine. We're not trying to tell people not to get the vaccine. The point of this story is just to have a community connection and just for us to show real people in our communities, making this choice to get the vaccines and seeing how they did, with the symptoms after it, whether it be no symptoms or, pretty serious ones. Mike, Jamie, I appreciate you guys so much. How do you feel moving forward? I mean, I know, Mike, you said many times this was like Christmas morning for you. How do you feel moving forward from this? Do you feel like, and we labeled this story COVID-19 finish line, because it kind of does feel like a finish line, right? It feels like you're getting somewhere, you're crossing a finish line here.
Yeah, it does feel like that. It's nice to see that people are still out there getting their vaccines. There's still a large percentage of people that aren't, and I understand that hesitancy. I think we can make life-changing. We can get closer back to where we should be when this all began, even if everybody doesn't do it, right? So I just feel like it seems like a lot of people that I know are getting the shots, and the precautions are being taken where they need to be, but we're learning more. We're not being, crazy. I'm looking forward to be able to ride on an airplane and not wear a mask. That would be nice. I'd like to consider taking a cruise and not thinking like, we're going to be on this boat full of 3,000 people or masked people. I mean, wearing a mask, my son said the other day, he said, I've kind of gotten used to it. Like, I don't even really notice it anymore. But I work from home, and so I don't go out very much. So for me, wearing the mask is a little more cumbersome. But I think there's a lot of people that have just gotten used to it, and that's their life now. But I do feel empowered, to taking baby steps towards getting back to where we were. And I feel good that our family has done everything that we ourselves can possibly do to help everyone. And that's a good feeling.
Yeah. And Dr. Osiyemi, do you feel like your patients feel the same way, once they finish the series and they come to you? I mean, what are their reactions?
Oh, absolutely. And I think from my personal perspective, when I look back to last year in March or April, we used to take care of about 80 patients in the hospital with COVID. People were dying. People were, struggling to breathe. Now we see maybe 10 people in the hospital. And just to show you what the effect of the vaccine has done, getting people vaccinated, the number of cases has dropped down dramatically. The patients that feel more comfortable coming to the hospital, to the office, they're not scared anymore. There's the anxiety level has gone down, which is, people who have COVID infection, they have a different anxiety. I mean, some of them have this post-COVID syndrome where they still short of breath, where in every little thing that happens to them, any little cough, any little ache, they are afraid they're going to get this again. And there's so much relief on one hand from getting the vaccine, and there's so much anxiety for people who had the infection or severe infections. For me, it's a big change, a big improvement. I'm so happy that I can actually slow down a little bit and take a breath and be able to go out like everyone is saying. When you get the vaccine, it gives you that sense of comfort, that safety net. Even if you do get the infection, you get mild illness, you don't feel very bad, and you don't end up in the hospital. So kudos to everyone who had the vaccine. I hope more and more people get the vaccine. It's very important that we get to the point where we can actually go out with no mask.
And I just wanted to bring this up because I don't think we touched on this. Melissa Yan brings up a really good question. What are the normal side effects of the vaccine, the normal ones? Anything that you can experience? I know for me it was like fever, I had chills, I had a little bit of nausea after the second dose. Dr. Osiyemi, what are the normal, I guess, the expected reaction if you do reaction?
Well, the most common side effects would be pain at the site of injection, achiness at the site. You can get a little swelling in the armpit where your lymph node is. You can get a fever. I had body aches. I felt fatigue. Those are all symptoms. Now, what's common? Well, you may have, 60% may have. Most people have pain at the site. They have symptoms. That's the most common side effect. The other most common side effect will be body ache and fatigue. Fever is not as common as those other ones. Sometimes people get redness around the site. It looks like they have an infection, and it's not. It's just a reaction. The armpit swelling and tenderness, that can be very uncomfortable, and that can last days. That's not common, but it can happen.
Yeah, the most common thing I've heard from people is that their arm just feels really sore, like they can't really move it up high enough, or it feels like they worked out really hard and can't move their arm around, don't have that mobility. I've also heard from people who had like really large, like pretty significant swelling in the area of the injection site. I think somebody earlier commented like grapefruit size, like pretty large swelling. So is that something that like at what point could you seek your doctor, talk to your doctor about a reaction?
I think if the reaction is not severe enough and you can control it with Tylenol, and just wait 2 or 3 days. If it's improving, great. If it's not improving after 2 or 3 days, it's getting worse, then call your doctor just to make sure everything's fine.
Thank you all so much. I really appreciate your time. Thank you all for joining us and asking questions and putting in your comments on your reactions of the vaccine. Again, tonight we're airing a story at 11 o'clock on Channel 5. You're going to get to see these amazing faces again and a few others who allowed us to track them for 24 hours to see how they did with their second dose of the vaccine. Have a great evening, everyone.
Thank you.